So let's have a think about place of birth and try and break that down into simple places that you can see exactly where things might change. So often people start in labour at home. Some people would choose to have a home birth. Now, the idea with a home birth or labouring at home is that you're in your own space, you're in your own environment, there's things around you that make you feel comfortable, which helps the oxytocin to flow. You can use things like self-help methods, and lots of people do spend quite a lot of time at home in early labour. So I always say, plan for a home birth, even if you're not planning a home birth, because you just don't know how long you might be at home in labour, and sometimes things do progress quite quickly. After that, people do like to try the birthing centre. Now, not every unit will have a birth centre, and that's okay. People get really hung up on this idea of a birthing centre because of how it's kind of comes across and how it's described. The idea is it's a home from home environment. So whatever you do in that space, we're trying to mimic that home environment to mimic the hormones. Now that can be done any space you go to, whether it be a labour ward or a theatre setting. We want you to be mimicking those spaces. So in a birth centre, you're cared for by midwives. There's no obstetrics team. It is just midwife-led care. So if you've got a low risk pregnancy, you might be offered to use a birth centre. Some people decide to go straight to a labour ward room, and that's fine as well. In a birth centre, you've got the options of self-help, pain relief like you have at home. You've got the option sometimes of using a birthing pool. You've got the option of using gas and air once you're in established labour. And sometimes in some units also pethidine or diamorphine, which are injectable opioids. After that, if there's any changes to the labour or any changes to you and what you want to cope with your labour, then you might be moved to the labour ward room. Now, in most units, the labour ward room is through a door and you've got that extra support and care there. So it's normally a safe space between a labour ward and a home birth setting. So once you go to labour ward, you're going to be cared for from a mixture of obstetrics doctors and midwives and anaesthetists if needed. Now, you are going to get your own space still, and you can still change that space lots of different ways. So whether it be turning the lights off, shutting the doors, making sure that it's that safe and secure space where you can help your oxytocin to flow and that labour to progress. The added extras in labour ward are you can be monitored continuously. You might need extra different things that speed up your labour. You may be offered different types of pain relief. So you can still use gas and air, you can still use pethidine, diamorphine, but then there's added extras of remifentanil, which is a pain relief that's controlled by the patient. You can also use an epidural, which is a full block from waist downwards. And these things have got to be kind of cared for and controlled by an anaesthetist and an obstetrics team for that extra monitoring of your baby and yourself. So some people's labour will progress there and they'll give birth in the labour ward. Other people might also then go and see the theatre setting, or you might be booked in for a planned caesarean birth. Now, in that theatre setting, it can be quite daunting. So I always say in the antenatal period, definitely have a look at what theatres look like and what the setup is like for obstetrics. Your midwife will still be there with you. She'll be up at this end and the doctors will be doing their thing at the other end. It can facilitate different things: caesarean birth, assisted birth, if there's any complications afterwards with your placenta, and any various other things that may change in your labour. So it's definitely worth having a look at all the birth places, because you might not just see one, or you might decide that actually that one's right for you because they can offer you certain things that the other place can't. So it's definitely worth having a look at what's available in your local area, and if there's any extra questions about birthplace and environment, then please do drop a message in the comments box and I will gladly do a video on it and answer your questions.